Okay, I
Good
think
morning, everyone.
we are all present. We can go ahead, Mr. Gant. It's okay if we get started?
Staff is ready.
Wonderful. Good morning, everyone, and thank you
Morning.
for attending the July 20th operations meeting. We have a pretty full agenda scheduled for today, so I asked two things. One of the presenters to please try to stick as close to your presentation times as possible, and two of my board colleagues, I asked that all questions or any comments that you need to bring forth to save those for the end of the presentation. Okay? So let's get started with the immunization update.
Joe is going to project the slides.
Wonderful. Thank you, Dr. Fink.
Okay. Good morning, everyone. It's a pleasure to be with you. We can start with the first slide. And it's our immunization update, which is an annual update that we present to you as we go along. I'm not going to, you know all the information on here, so we're going to tell you just a little bit about where we're going and what we're trying to do. On the first day of school, we expect ours to be at 99.1%. We're not going to say 100% because the numbers can really change almost any day of the week. The state of Maryland requires students to have immunizations in order to attend schools. They attend school without immunizations. One of the things that happens is that we do not get funded. There have been some real barriers this year because of the fact that parents weren't able to make doctor's appointments, that parents weren't able to do some of the things they needed to do to make sure they were going to be able to get their immunizations. We are working with them. As of this morning, we were at 97.1%. It sounds good as a percent, but it means there's a lot more students we still have to get to. There are on the slide here and in the information we're disseminating to the principals and to the schools, there are additional information about where they can get testing and how they can do. I'm pleased to announce that Mount Washington Pediatric just announced that they were going to be opening clinics for our students too, where they will be getting students and having them come there. We are anxious to make sure that even though we are all of us that work on immunizations are committed to the fact that this is what students need, and students need to be immunized against the childhood diseases that really made life miserable in the past. We are also aware that the state of Maryland does not fund students who are not immunized unless they have a religious or a medical exemption. So we're on this on two things. One is to have them all immunized before the child count, and the second is to make sure that they all get immunized for their health. Next slide, please. This is our data from the different years that we've come along there, and right now we're up from where we were when we sent this in because fortunately things are going by, time is going by. And I'm going to ask Valerie to speak a little bit about this. Valerie Dudley Cook is our immunization coordinator who's been doing an outstanding job. Valerie? Or did I?
Good, no, I'm good, I'm here. Took me a moment to get that mute button. So as Louise said, on that previous slide as well, those were some of the, takeaways from the pandemic. So when you go back to look at that slide, you can see some of the, we did have restrictions due to the pandemic, and there was limitations put on parents being able to take their children and for children to receive vaccines. There was a lot of apprehension and fear surrounding COVID. There was a special absence code that was provided for students that were non-compliant for immunization.
Thank you for that suggestion. I just wanted to add there that 10 to 1 time that's on there and the times that are there in the afternoons are really just for the children's vaccines. All the other places where you can get COVID vaccine right now are operating much, much longer hours. You can walk into CVS or Walgreens and get a vaccine there. There's no charge. So,
well, I'm still saying they need to extend the hours because the parents are even more important. When the parents are sick, we lose a parent. It's unbelievable what the results of it as far as our children in Baltimore City. But I think that it should be a bigger conversation about the times that's available for us to get a vaccine.
I agree, and I will bring that to the attention of the health department as a recommendation.
Okay, thank you very much.
We meet with them regularly.
Okay.
And we hope that people will take advantage of the vaccine times that are available. They're available all over the city. And I'm encouraging everyone, anyone who has a friend who has not been vaccinated for COVID, tell them they need to go and get that vaccination.
Well, even though that's for the children from 10 to 1, they still have to have a parent with them.
They have to have a parent with them, right?
And so the parents are at work.
Well, they're not all from 10 to 1. That is just the health department. There are different times for different places, but we will encourage everyone to do their times differently. There are 2 large clinics that are going to be held on Saturdays that are being done by Mount Washington Pediatric. There will be other clinics that will be on Saturdays, so they will be able to get that as well.
Okay, thank you so much.
The only time that was up there with that 10 to 1 really was at the health department itself.
Okay, thanks a lot.
You're welcome.
If I could just interject, I'm the acting director of Priority Initiatives, and I'm working very closely with Dr. Fink on this project with city schools. And to her point, we are also doing, we're partnering with the community schools and engagement office to have clinics at family fun festivals over the summer. And those are intentionally being scheduled on the weekends because we understand that, parents are working during those times where, a lot of our school clinics even are only open during the school day. So we are trying to be more intentional about addressing our parents. And I completely agree with you, Commissioner Michelle, that parents are vaccinating the families, including the parents, is just as important as vaccinating the students, because we don't want anyone within the household to get transmitted with the COVID-19 virus. So thank you so much for your suggestion. I'm going to make a note of it, and we'll see what we can do with the Baltimore City Health.
And one last note, I'm going to get off the bandwagon. The one last note, we talk, list it. What we just said, we said all these different places that you could get with the times. It would be wonderful at the bottom, you would list all those locations with times, because we say all of this, we hang up the phone, we move on, and they say, what did they say? Just list it and they can copy it, and it will help them to find the location.
Absolutely.
Okay, thank you so much. Okay.
Thank you. Do we have any further questions?
I do. Before the sake of time, I will submit it in writing so that we can transition to the next presentation. But thank you so much, Dr. Fink, to you and your team for the immunization update. Next, we can prepare for the school police update. I think that is Colonel Coleman.
Thank you.
Good morning.
Did I get your title correct, Colonel?
It's Major Coleman.
Major Coleman. My apologies.
But it's okay. It's okay. No problem. I'll take it. Right now, I'm just going to be doing an update on school police. Of course, the mission statement of the Baltimore City School Police is create and maintain safe learning environments, and we accomplish this by developing positive relationships, delivering high-quality professional services, and equity and impartiality. We also provide support to the Office of Special Education, school social workers, and school psychologists upon their requests. And right now we do a lot of collaborative training with the school police and social workers. One of the trainings that we did was the Handle with Care initiative, which is district-wide, the Go Guardian alerts, emergency petitions. We're assisting social workers and psychologists on emergency petitions, and this district-wide crisis intervention and CPS notifications. The social workers provided training to all of the officers on emotional learning for the school police officers. And we've had some mental health and substance abuse training along with the social workers. But we engaged in a training at the National Council for Judges, for Juvenile Family Court Judges. And I attended this training with Dr. Claudia Webb and Ms. Nicole Chop, I believe her name is Chop. She works upstairs. Yes, Chop. And we had also attended with Judge Emmanuel Green, who's the chief judge of the juvenile division. And we worked on diversion programs, which we had a conversation on how could we reduce the amount of kids going into the juvenile system. And so we came up with some diversions, and further inside this presentation, you'll see some of the numbers that we've had with our diversion. We can go to the next slide. The self-harm alerts, I'm going to let Dr. Webb, she's also on this. She's going to talk about the self-harm alerts and how we interact with the social workers and the psychologists and how we support them.
Good morning, board. The self-harm alerts refer to the Go Guardians that Major Coleman mentioned earlier. Self-harm and the Go Guardians really focus on situations in which kids may be searching on their laptops for information around how to harm themselves, or it may be information on how to harm others. And it also will trigger if kids are searching sexually explicit and violent information on their laptops as well. So when we say self-harm alerts, this is really reflective of those three different categories that children may be searching on their laptops. And when students do that, we usually will have someone to contact the family directly and reach out to those students and provide the family and the students with support and resources, community resources around those particular concerns. Next slide. Emergency petitions are these are initiated by the school social workers, and they are usually situations in which students have threatened to harm themselves. A lot of the emergency petitions are usually done when the children are in the building, you know, when we are face to face with them. We do very little emergency petitions during the virtual environment situation. But these emergency petitions, these numbers are reflective of the social workers who initiate those petitions to try to support students to get them to emergency psychiatric evaluative services. Next slide.
Right now, we're going to talk about the diversions. So far, we've had 63 diversions, and you can see in school year 2019. Of course, last year it wasn't many, and then this year we've had 3. Diversions are for cases that could possibly be a misdemeanor charge for a kid. So instead of putting the kid into the juvenile system, what we're doing, we created diversion programs. We partnered with community mediation and teen court. So some of the minor offenses, what we're doing is writing a report and we're forwarding to these to diversion programs, and then they're interacting with the kids and the kids' family and engaging them and creating corrective behavior and not just putting them into the juvenile system. You can go to the next slide.
So this next slide is just some more current information around the Handle with Care, self-harm and behavior threat assessments for school year 2021. The Handle with Care, as Major Coleman mentioned earlier, is really when law enforcement have an encounter with a child, you know, during a call. It may be at night or any other time, and usually, you know, they just contact the school the next day with 3 words: handle with care, and that's to alert our school social workers and school psychologists and the school administration that this child may have experienced a traumatic event the night before, and for us to take that into consideration and provide whatever supports the student may need in terms of trauma responsive interventions, or either just support or reaching out to the family. We had approximately 2 behavior threat assessments for the year 2021. And then the self-harm, of course, are the ones that I discussed earlier in terms of the Go Guardians. And the total approximate number up to this current date is over 1,000 Go Guardian alerts that we've received.
And right now, school police officers are continuing professional development around restorative practices. And of course, the restorative practice is working well with our officers, I can tell you that. And I think that we need to push for more restorative practice around, not just with the officers, but I guess the whole community needs that, as well as the custodial staff and other members within the building. You can go to the next slide, Joe, because it has assisted us in providing a decrease in our arrests. While all school police officers have been trained, everyone, of course, you can go to the next slide. Our next steps is continuing implementation of the revised school police policies and our general orders. We're working with the legal department, and they're doing a comprehensive review of our general orders and best practices. And then we're going to receive feedback from the stakeholders. but we're currently doing all state mandated training and supporting the learning sites, summer learning sites. Again, with the ongoing trainings, restorative practice, we're doing holistic mindfulness for all of our new officers, youth mental health, peer mediation, conflict ready resolution, understanding youth culture, historical racial context training, school climate, and all of our new officers are going through the National Association of School Resource Officers training and receiving CPI nonviolent crisis intervention and de-escalation training. Any questions?
Yeah.
Oh, I was just going to say thank you so much for the presentation, Major
Real,
Cole.
Commissioner Roberts, this is quick. I'm not going to take a while. I just was wondering if you get involved in the truancy department when students are not in school and or there are questionable reasons why they're not there, and and it's a concern, do you make home visits, or is that a part of what you do, or you don't do that area?
No, that's under, I believe, Dr. Warren's office, the whole child. I believe they're taking care of that.
Okay.
And I can tell you that Judge Emmanuel Green is one of the judges who oversee the truancy.
Right, because some of the things that you're doing package into the reason why they're not in school. And I was wondering if there's an overlap, you know, some of the things that you say you're concerned with of the whole child, you might find it is the reason why they're not in school, and if they have to send somebody out, or if you were involved in that, but you say you're not.
Well, if they ever had to do a home visit and they needed someone to support them, or if they needed us to accompany them, we would do that.
Okay.
No problem.
Okay, thank you.
Dr. Warren, was there something you wanted to add to that?
No, I wasn't sure. I'm happy to provide more information about that truancy process if it's helpful, but I don't know if now is the right time for that, or if that would be useful or not right now.
Commissioner Bondema, I'll defer to you.
Oh, I'm good.
Okay.
Okay, thank you.
Thank you.
Commissioner Reed.
Thank you, Major, for your presentation. Looking at the nature of restorative practices, wellness, and safety, it looks like the nature of policing's changed. So in terms of your relationships, your role, and your approach, how's that dynamic change, say, from 5 years ago? And also, how do you see it going forward in terms of your whole, the nature of school policing? It looks like you guys are the tip of the spear. So you guys could be a model for a lot of people. So how's your role, your approach, and your relationships changed?
Well, one of the things is building that relationship. And what we do, we try to have the officers start working on that relationship from the first day. The first interaction with the kids, a lot of our officers are coaches, they're the mentors in the within the school. They engage the kids. Like I believe the last presentation I may have mentioned to you, like they're out there in the mornings. So when the kids are coming in, even if you're just speaking to them, good morning, that breaks the ice, because some kids don't really associate with officers. They don't interact with them. So what we have to do is we have to break that ice. We have to break that barrier down. And so what we have to do is by just engaging them in a positive manner, non-law enforcement interaction with them. And that breaks the ice. And you can, once you do that, then you can start interacting with them more and more and getting to know them. And that's how we've been successful in decreasing our arrests and just being more proactive in just some of the interactions that we have with the kids.
Thank you. I guess another thing, Madam Chair, this presentation comes to the full board at some point, correct?
I'm not sure.
No?
This is Christian. I don't believe so.
Okay.
And there is a school police update scheduled for the spring, which I believe will include the survey data, but I believe it's only an ops.
Okay, I guess in terms of optics, Major, you do a tremendous job, but I guess in terms of if there's going to be a public viewing, hopefully the chief can introduce you, just so the public can see who the chief is and where the decisions emanate from. Because I don't think enough people know who Chief Ham is or what he even looks like. So I think that would be helpful. Just pedestrian opinion.
Okay.
Can I just make one clarification here, Commissioner Reed? This is Allison.
Yeah.
So Chief Ham is out on medical leave, so that's why he's not here. And so Major Coleman has been filling in while he's been on medical leave and just doing a tremendous job. But that's the reason Chief Ham is not here, is because he's on medical leave.
Okay. Thank you for the clarification. Thank you.
Yeah.
Thank you, Major, for your presentation too.
Welcome.
I do have some questions. Major Coleman, if we could go back to the restorative practice slide, I would be really interested to learn of the larger number or the number of officers that we have as a district, how many have participated in the restorative practice training, and how are we evaluating the effectiveness of the training within the larger city schools community?
All of the officers are required to go through restorative practice training. That's a mandate. All of them go through it.
And so then my follow-up to that is, how are we evaluating, what they've learned in the training, how they are engaging with students, staff, teachers, the larger community, city schools community at hand?
We don't have a tool to evaluate it. However, we're seeing a positive impact. We're seeing a reduction in crime. We are seeing more engagement of the students and the staff within the building, more participation, just being a part of that community, not just coming in policing the school, but actually being a part of it.
Got it.
So I believe that a lot of the restorative practice that they received, the training that they received, helped break that barrier and get them to see it from a different lens.
And then the other thing I would add would be the tremendous decrease in arrest rates that under Chief Ham and Major Coleman's leadership that we've seen over the past few years. And it is, we are one of the lower jurisdictions in the state in terms of our arrest rates, and it has gone down precipitously under leadership. I don't know what the number, I don't know if Major Coleman remembers the numbers off the top of his head, but they are very, very low. And indicative of the work that they've done to build relationships with students, to provide training to their officers, to carefully select officers and deploy officers. So it's evidenced in a number of ways in terms of the way that officers interact with students.
Thank you so much for that, Allison. I just have one more comment, and I believe I see your hand, Commissioner Griffin. I just ask that the next time that this presentation comes, if we could have some insight into what the relationship between school police and the student wholeness office looks like, if there could be a bit more context around what that relation looks like in the deployment of services for staff, students, teachers, the larger city schools community, that would be really helpful to see what that collaborative effort looks like. And potentially, as you all are looking at a framework to measure the evaluation, we can see the impact for our students especially, but for the larger city schools community. Commissioner Griffin.
Good morning. Thank you, Madam Chair. Good morning, everyone, and thank you, Major Coleman, for the presentation. I know we've had a chance to talk, and apologies for being off camera. I'm out and about, so I don't want anyone to think I'm being rude. One, thank you for the presentation. I really did enjoy seeing how there's the cross collaboration, like seeing it a little bit more laid out between the student wholeness folks and the school police. I had a similar question around how we're measuring the impact, because it's one thing to have the data saying that the arrests are decreasing, which is great. It's great to have the numbers showing like how we're able to divert some attention to students who may be expressing self-harm, or students who may need extra care or tender care when they're being handled for certain situations. But I think that it's time to think about what these measurements or indicators are that show us that we're being successful in implementing this more holistic approach to policing in schools. Using the practices of like restorative practice and partnering with the student wholeness partners and the psychologists and the social workers, because that gives a more holistic view of how all of these entities are working together, and it takes the school police out of being just this separate entity that folks like to target to say, oh, you know, we don't want schools, we don't want them in our schools, versus saying, well, actually, this is a part of our entire strategy of how we support our students. So I would love to just put that out there as a thing to think about. Questioning whether there are other like school resource officers or other departments that possibly utilize metrics, or if we can even, if you all could even sit down with the student wholeness department and think about how they measure their impact, and how that could be translated to be something that is utilized by all of the departments holistically. So we're getting more of a bird's eye and a micro and a macro view. Each department, what are the key things that we do? Like, what are the actual actions that we take that are impacting students' ability to exist as their whole selves and be successful and healthy? And then overall, all of the departments working together, I think would be a great way to just say, to tell that story, you know, to tell the story through the numbers. I think the only other thing I have to say is more to Commissioner Reed's comment. Like, I really hope some of this information is incorporated in the presentation that is going to come to the board that talks more. I know we're working on the policy that's going to come to the board, but this background context is so helpful. And I'm glad I had the chance to pop in today. So thanks for allowing me to observe with the operations committee. But it's good for this to also come to the public too, if they haven't seen it here, and they're more likely to attend in the public meeting. So I'm not sure like what pieces can be pulled, especially that cross collaboration piece. I think is a really strong, it's a strong component of the work that has been done. And I am not sure if everyone out there knows that this wonderful work is being done. So just wanted to give those two pieces, and thank you once again, and thanks for letting me pop in, y'all.
Okay.
Anytime, Commissioner Griffin. Mr. Dent?
Oh, just wanted to clarify. Like I said, currently this is not scheduled for presentation to the full board. If that is something the operations committee would be interested in, we can figure out where to schedule it. But just wanted to clarify that right now, this presentation is only only scheduled for ops.
I also wanted to clarify that Dr. Webb, thank you so much for participating in the presentation alongside Major Coleman, but Dr. Webb is actually a part of the Office of Special Education and not Student Wholeness. I think I misstated where her role actually lives. And the Related Services department is actually a subcomponent of the Special Education Department. And so I just wanted to offer that clarification just so we have a visualization of where the respective services live within the district. Thank you so much again, Major Coleman and Dr. Webb, for your presentation. If any commissioners have any follow-up questions or comments, they'll be sure to send it in writing. We can transition to the next presentation. Thank you all for sticking to your time. We can transition to the next presentation, which is the overview of district level communication strategy.
So good morning, commissioners. This is Tina Highcover, Chief of Communications Engagement and Enrollment. I am just here today to introduce Andre Riley, who is the Director of Communications. So we'll be providing the update to you on our communications plan, but I am here in case you have any questions or thoughts afterwards when I came on, because I heard Commissioner Reed say, have your chief show themselves to the public. So I am here, Commissioner Reed, supporting my director in delivering the presentation to you today, which we jointly put together. So Andre, please go ahead.
Good morning, everyone. Hi, I'm Andre Riley, the Director of Communications. It's good to see all of you again, even virtually. Hopefully one day we'll see each other in person as things develop. I'm going to share my screen with you, and then we'll go through a very quick presentation. And afterwards, I'll be more than happy to answer your questions. Because I'm sharing my screen with you, if you raise your hand in the middle of it, you'll have to let me know so I can make certain that that I know that you have a question, and I'll stop and I'll answer it. Does that sound good? Yes.
It works just fine.
Thanks. Sorry, yeah, I can't see you. Okay. The strategy of communications in city schools, it's informed by a number of different variables. We start with the bolded one at the top. Our goal, communications-wise, is to support the goals of the Board of School Commissioners via its policies and to align with the district's strategic plan set by the CEO, the Blueprint for Success. All of our communications start with that main idea. And then we go down to the ideas that Chief Pike Hubbard has set out through the Office of Communications, Engagement, and Enrollment Choice and Transfer. And our goal in that office is to connect families and provide them with the resources, the supports, and the information that they need to support the development of their students. This is big for Tina, and it leads us to collaborate with our cousins in OCEE, for lack of a better term, such as family engagement, community engagement, and the Office of Enrollment, Choice, and Transfer. When we all work together, we're able to connect families with what they need to be supportive.